Hi, it's Dr. Meyer, and today we're talking about SIBO causes. Hey, welcome to my channel. I'm Dr. Shelley Meyer. I'm a functional medicine doctor, family doctor, and registered dietitian. And I talk on this channel about gut health, hormone health, and metabolic health. So today we're kind of going back to our gut health roots and talking about SIBO again. This is a very popular topic on the channel. I get lots of questions about it, and I even have a SIBO ebook to help answer all your questions, but I'll talk about that later. But today we're talking about causes and root causes of SIBO, because people often ask me, how did I get this? How can I stop from getting it again? Let's go back a minute here. I've helped hundreds of patients in my functional medicine practice, Highlands Health and Wellness, with SIBO and gut health. I've put out the word here on YouTube and helped a lot of people there too. So if you want more information on SIBO, please check out my other videos. I just made a new playlist today. So SIBO, small intestinal bacterial overgrowth, and it can involve methane dominant. They're not really bacteria, but they're methane producing. They eat up the hydrogen. It can be hydrogen dominant or it can be hydrogen sulfide dominant. So I dive into that a lot on my other videos. So check those out if you want to look at the different types and the different tests. I do have some SIBO test kits available in my lab shop, and the details of that are in the description. But let's talk about first symptoms of SIBO. So SIBO can make you more sensitive to foods, particularly carbohydrates. So if you find sugar is a big trigger for you, if you find bread and it's not just a gluten issue, or grains are a big trigger for you, or pastas, not really rice, but like processed flour-based things are a trigger for you, you may have SIBO. And what I mean by trigger is that it could cause gas or bloating or diarrhea, constipation, leaky gut kind of symptoms, even can affect your skin. Acne, rosacea, psoriasis can all flare up from SIBO. You can also have fatigue and nutrient deficiencies, so that could manifest as vitamin D being low, B12 being low, and you don't know why, and you eat plenty of meat. So there are a lot of different things that SIBO can cause. So the symptom-wise, if you're having unexplained symptoms, it could be gut related, and it is good to check out SIBO as a potential diagnosis. You can also be low weight or underweight, but I've also seen people gain weight when they have SIBO and then they lose it when we treat the SIBO. Another kind of interesting thing. Anxiety, brain fog, and depression are other things that can be there when you have SIBO. So that's a little bit about how you feel when you have SIBO. And again, I have covered it in detail in shorts that I have on the channel and other longer videos, so check out the playlist. Okay, let's dive into what protects us from SIBO. So proper gut motility, that's why I talk about prokinetics and motility so much, and fasting and meal structuring, because you want to have your food, the migrating motor complex, doing its job when your intestines are quiet and pushing the food through the intestinal system, so that not when you're digesting, but when your intestines are quiet, everything's moving through, nothing's getting kind of backed up or stuck and causing potential bacterial overgrowth. So that's one thing we need to have in place to protect us against SIBO. We also need to have a good digestive system that's not obstructed, doesn't have a lot of scarring there. We need to not have fistulas, another problem that can happen with our intestinal system. We need to have enough betaine HCl, so that's stomach acid basically. We can have too low of stomach acid. If you feel like you have that and you've been treated for GERD and you've been on omeprazole or Protonix or some of the proton pump inhibitors, please check out my H. pylori playlist and my stomach acid videos in the gut health playlist, because that can be getting in the way and can be causing SIBO. We should have a functioning immune system in order to protect us against SIBO. And then we should have enough bile in from our gallbladder into our digestive system to digest fats, and enough enzymes being produced by our pancreas. There are ways to test for this, so let's talk a little bit about testing for some of the causes. So for motility, that's tough to test for, although they can do a pH testing with at the gastroenterologist's office to look basically a test for motility for gastroparesis is when they do it. So I would say if you're having some severe symptoms or diarrhea, that's bad, or even constipation, something that really feels severe and you have a gastroenterologist, you may want to check for your motility. To look for structural issues, definitely imaging. Usually if it's pretty significant and you've had surgery or scarring, you can then have a CAT scan usually, or an MRI. Ultrasounds can look at your liver. They can look at your pancreas to look for like fatty liver, or pancreas to look for masses or anything like that. But the best way to check for enzymes is to do pancreatic elastase. Now you can do that, I think, via LabCorp. You can also do that from some of the test kits I have in my Rupa Lab shop that's in the description, and those would include the GI map that I talk about a lot. There's one that I've been using lately from US Biotech called the GI Standard. It's a little bit cheaper than the GI map. I'm going to add that to my lab shop. If you notice I haven't yet, please let me know in the comments. I'm going to try to remember. And it is a bit cheaper. So that's a good way to test for not only your bacterial balance, but your enzymes too, and if you're digesting fat, protein, and carbs. So great way to check for that, as well as to check your microbiome. Ideally, if money weren't an issue, I would have everybody that I saw and all of you out there checking breath testing for SIBO, and then also checking the microbiome so that we can complete the picture and see what the root causes might be. So those are some ways to check. Other things that can contribute to SIBO are medications, like I mentioned, proton pump inhibitors. Those are Protonix, omeprazole, purple pill, that kind of thing, Nexium. Antibiotics. So a lot of us have been exposed to antibiotics, and those can definitely cause leaky gut and microbiome imbalance, as well as cause SIBO. And then opiates. So, codeine, hydrocodone, oxycodone, those can all contribute to SIBO. And plenty of us haven't had opiates, but there are a lot of people who have been treated with opiates either chronically or acutely for pain. Parkinson's is another contributor to SIBO. So I talked about surgery before. Adhesions can be present, and it's kind of sticky after you've had surgery, areas in your gut that aren't allowing proper function in the gut. And those can come from abdominal surgeries, from endometriosis surgeries, from appendicitis and a removal of your appendix, and any kind of perforation. So if there's like a real damage to the gut and it's been perforated, either trauma or surgical trauma can create that. There's also Ehlers Danlos that can create or can contribute to SIBO. And there's no cure necessarily for Ehlers Danlos. We can work on it through physical therapy, there are some supplements we use sometimes to help the symptoms, and through sometimes low-dose naltrexone. There's not really a cure that's going to cure you of your Ehlers Danlos syndrome. If you don't know what that is, it's a lot to go into here, but basically collagen issues, really kind of hyperreflexive joints. Also, those are the people that might be called double or triple jointed. And it can often go along with heart issues, pulmonary issues, fatigue issues. So it's a lot to go into here. But if you do have that and you have collagen issues, that can contribute to SIBO. And then ileocecal valve dysfunction is another cause. You have an ileocecal valve. It's between part of your small intestine, your ileum, and your cecum. Large intestine, between the small intestine and large intestine. So that can create a backflow, and that can cause small intestinal bacterial overgrowth. And I talk about that in some of my shorts and some of my other SIBO videos. And I will be doing a short on something you can do at home to work on that. I haven't done it yet. So blind loops can be created with diverticulosis, with surgery, and congenitally you can have a blind loop in your intestine, and that can contribute to SIBO. Again, like I said before, not having enough stomach acid, so from the chronic use of the PPI medications or just from damage in general, or not having enough enzymes or bile to digest can definitely create SIBO. Hypothyroidism is another issue so if your thyroid's under functioning, your TSH is high, you're being treated for hypothyroidism, you can think of that as a root cause of SIBO. Traumatic brain injury is one that's not talked about nearly enough, and that can contribute to SIBO. And SIBO can be recurrent and chronic, as I've talked about in my other videos. So again, we can't cure Parkinson's necessarily. We can control the symptoms. We can't cure Ehlers Danlos, but some people still have difficulty with it. We have medications for hypothyroidism, but if those things remain unbalanced or the things that we can't really balance that well, you may have recurrent SIBO, and that's okay. I mean, it's not fun, but we do have ways we can help you through that. Traumatic brain injury, I already talked about. If you're immunosuppressed or immunocompromised, you can have so your immune system's not functioning very well. That's a risk for SIBO. Parasites are another risk. Lyme disease or other co-infections can be a risk factor for SIBO. Mold, that's something that often goes undetected. I've had issues with mold exposure before, and that can screw up your microbiome as well as your small intestinal bacterial balance. So be sure, if you're mold exposed or you have been mold exposed in the past and you're having other symptoms, you may want to check for SIBO. And then again, any kind of obstruction in the bowels, anything blocking it. Food poisoning is another big thing that can contribute to SIBO. So these are a lot of different causes that can contribute to SIBO. If you want to test for SIBO, be sure to check out my food marble videos. It's a small device that you breathe into that you can test at home, and then you can use that device daily if you want to look at your food triggers while you're treating the SIBO. So it's really handy for diagnosis and then for helping to manage the SIBO later and maybe find your trigger foods as well. So I have a 15% discount I'm going to try to put here, and then I'll put in the description how to get that. And then I do have my ebook, The Ultimate Guide to SIBO, very affordable. It's free, I think, on the Kindle membership, and then you can also get it pretty cheap on Amazon as well. And that's The Ultimate Guide to SIBO. I'll put a link in the description. So there are some great resources out there because the ebook goes over not only diagnosis, symptoms, treatment, both natural and prescription, diet, and then ways to try to prevent SIBO from coming back. So hopefully this information was helpful. I forgot to mention in the beginning, please like and subscribe to help the channel grow and to help me be able to continue making these videos. Also, I have supplements that are discounted on my dispensary, and buying those doctor trusted and really trusted, well-made supplements that are quality, buying those through my dispensary helps to keep the channel growing. It's almost like a Patreon kind of thing. So you do get 15% off, and then you can help the channel as well. So if you're looking for ways to help me make more content, because I do this in my free time on top of my practice, I would love your support. And thanks so much for watching to the end, and I'll see you next time.